Most of the brain training programs have been used in healthy older adults and in persons with mild cognitive impairment. And usually people agree that persons with Alzheimer's disease are not very good responders for that. What is very important in cognitive intervention is that the cognitive approach will depend on where you stand in the disease progress, and that some approaches are better suited for people who are fairly good cognitive abilities, whereas others will be better for those who have more cognitive problems. What is interesting about this study is that they use a computerized program. So, it means that you really multiply the potential access of people who are away and so on. So that's interesting. One relevant question is it as efficient, more efficient, less efficient than a face-to-face approach? And there's not that much study on that. I know of one study that has compared a face-to-face approach with a computerized program, and it was shown that it didn't really add much to a face-to-face approach. There are things you cannot really teach if you're using a computerized approach, because you need to show the people how it works, you need to correct the people, to give feedback and so on. And that's not something that a computerized approach can really do. The study is interesting. The effect size, what we mean by effect size is how much of an improvement you see. It's fairly small. It means that you may not see it by the naked eye, if you wish. So the effect is not huge on an individual basis. Huh? It's just when you put a lot of people in your sample, then you find a significant effect. And the other thing is that there's a lot of dropout in this study. People didn't stick to the intervention. So maybe because they got bored, or maybe because there's something in the computerized aspect of the training that doesn't really please. So people perhaps need to have this face-to-face ingredient that some other interventions have. A computerized program for AD people will have to be really well adapted to their difficulties and to their problem and to their needs. The literature indicates that for Alzheimer patients, you may be more efficient if you actually address difficulties that they have in their daily life with caregivers and address this particular problem, rather than having a program that just train general cognitive capacities. There has been a statement from the Stanford Center on Longevity, which and they were quite critical about the fact that the industry claims that these programs can prevent Alzheimer's disease. I think we have to be very careful. We don't have the data to show that these programs have a long-term effect on cognitive decline or on dementia. They seem to improve cognition on the short term, so they seem indeed to have some effect on cognition. But it's not clear that the effect is that much better than just learning a new language or enrolling in activities that are stimulating cognitively. I thought that this was a good study. This was an interesting study. There's a huge number of participants, but there's a lot of remaining questions. So it has potential. It shows that it has potential. But the problem is, of course, that the effect is very small. The effect size, the magnitude of the difference between performance before training and after training is not that huge. It may make a difference at the population level, but may not be that clear, or you may not feel such a difference as an individual. And also, I was a little worried about the dropout rate, the fact that so many people stopped to use the program after 3 months. So it means that perhaps it doesn't really suit the needs of older adults. It's too complicated, perhaps, or perhaps too repetitive, or perhaps it's perhaps it's too competitive. And remember that it's also the case for physical activity. People start to do physical activity and then they stop after 3 months. So there's also, people have to change their lifestyle. They introduce a new activity, and it's not that easy to change a behavior and to introduce a new activity and to keep the new activity in your daily schedule. So there's really an issue of how you actually integrate in your real life activities that are cognitively stimulating. And perhaps we should help people or we should propose to people activities that make more sense. Maybe one approach would be to use activities that involve groups, so that they are more rooted to the community, on the contrary. So, for instance, in the United States, they use volunteering as a way to stimulate older adults. So, and it was intergenerational. People were just involved in activities where they would help young children at school to do their homework, and it increased their cognition. It made changes in the brain of individuals. So you see, and why is it stimulating? Well, it's because people learn new things. They have to adapt to different situations. They use their body of knowledge, and they use it in a continually stimulating manner. So that's a very stimulating activities, and perhaps for some people it makes more sense than using a computerized program, and perhaps it has the same effect. So I think that there's a lot of avenues to stimulate cognition. What is important is that we know that people have to remain active cognitively, not only physically but also cognitively. So what is the best way to do that? How do we, what range of activities would provide individuals so that they can remain active? That's a question. That's a good question, but it may not be only through computerized program.